All right, so this is the Coflex device, and it's a nice little device for the patients that need decompression in their spinal column from the back of some scar tissue, and we want to maintain some of that normal anatomic motion. We want to avoid effusion. The patients, they don't need all of the screws and rods and all the big surgery to fuse the bones together. You can go in and decompress and then slip the Coflex in. It gives the spine and the joints of the spine some support, but also, because it's kind of a spring, it acts as a supportive spring in the back to allow the motion to maintain and prevent further breakdown and scar tissue formation in the future. I have a few patients that we've used this on. Very good results. You know, it's an incision in the back, but it's almost minimally invasive in the aspect of it's a very small opening. It's a very small opening over the nerves to decompress things. You leave the bone all intact and you slide the Coflex device between the lamina and the spinous processes of the bone, and you lock it in there, and then it maintains that motion and helps patients really recover quickly and alleviates their pain and the discomfort that was there from the stenosis that they had. The recovery for Coflex is very similar to a simple laminectomy with a small incision, a small access, and patients can go home same day following surgery or home the next day if they choose. So downtime following the surgery is really patient dependent. If it's one level and it's a same day kind of surgery procedure, they're up and walking around that day and the following day, and it takes them a little bit of time to recover and get back to their baseline, but for the most part it's very well tolerated. I usually recommend to my patients activity and everything within moderation, all activity in moderation, but that doesn't really limit them to having to avoid anything. There's really minimal risks to the Coflex procedure because it's the same approach as we would use for a laminectomy. And with the added bonus of the Coflex is when you place it in between the bones, you leave the native bone intact, and it acts as a little spring with support for the joints on either side, and it actually gives more supports than just a simple laminectomy on its own.